Thanks, Martina. The next question is from Carol. Employee assistance programs or EAPs are available. What might be some of the reasons why they are not used? Can I start by answering that question? 2 points, and then you can take over from there.
Go for it.
The first reason, and this has improved a lot in the last 12 to 24 months, but the first reason is that employees don't know it exists. I have known people that worked for the health departments in medical professions, and they didn't know that they had EAP support, believe it or not, in a super highly charged, burnout-laden profession. And one of the second main reasons is that employees are highly concerned about their confidentiality and the impact that disclosure will have in their position, in their future prospects with the organization, or even in things such as judgment from their colleagues, because they don't know who gets given that information, how it's used. So those are definitely two very big concerns. But what else have you come across, Martina?
I think much of what you've said was found in this study, but I'd add to it that, yes, definitely for those participants who were the most common thing that people said was it was usually the only offering that was offered when people were distressed. And so that actually relates closely to a lack of a manager knowing what to do to respond to someone who's just set on suicidal, was to pick up the phone and refer them to the EAP. And so for most of the participants, they didn't have good experiences, which meant that later on they weren't confident going back to the EAP. Did have a couple of participants who had quite good EAP experiences, but then for some reason were moved on to other providers. So but broadly, EAP did not get a very good rap from participants right across this study. And again, it was that the underlying message of, it was usually, if there was EAP, it was usually the only thing we were offered in terms of a response or a support or accommodation, is off you go and see the EAP. And then there was this thing about, they weren't skilled in what I was feeling. They were just, providers, so not necessarily skilled in dealing with suicidality.
Another interesting point is that I had a conversation with an EAP provider approximately 12 months ago, and the owner was saying that typically EAP usage is between 7 and 11%, and that a lot of EAPs were just basically trying to charge, put several other products layered on top of their service to try to make some extra earning on that. And obviously this would have changed a bit, probably improved in the last 12 months, because technology has allowed a lot of the online coaching, sort of online support through telehealth. That wasn't something that was available before, but it's still obviously underutilization is a massive issue. And it also raises the question, if there is appropriate utilization, does the EAP model break down because they can't actually afford to run EAPs anymore? So those are very interesting questions.
Yeah. But I also think, Pedro, you mentioning specialization, has the EAP providers got the right suite of skills to support the workplaces that they are the provider for? So that would be the caveat.
Absolutely. Where do you think we're at this point in time with regards to mental health and well-being awareness at work? Obviously, this has been a topic that has exploded in the last 12 to 24 months, at least in the discussions online, in the discussions with HR, with policy coming around psychosocial hazard identification and all the requirements that many states now have to abide, private organizations, being liable for massive fines and things like that. But in your view, do you think we are progressing fast enough, or do you think the progress is heading in the right direction, or at least being implemented correctly? What are your thoughts around that?
Look, I have to say, I think after doing this study and thinking about the systematic review and it came through, Pedro, in some of the data, to be honest, some of the comments are, look, even if you start implementing things in the workplace, so addressing psychosocial safety, making sure there's safe people, trusted people, whatever, some of it does have to come from a really high governmental level in terms of policies, legislation, and a couple of people actually said that until the government did something and changed something, that's only when things will change. But I do think that, again, I'm more hopeful than not, if it makes sense, because I can see that this topic is getting a lot of attention. As I said, with more than 60% of the population working, that affects all of us. We know people who are working, or we are workers, right? And so it should matter that we are all well at work. And so I do think it's great that the work that the World Health Organization and Australia is doing, that we are starting to look at it, though, from what I'd say from a health promotion and a health equity lens and a strength-based lens, rather than just continuing to focus on the deficit. So I'm hopeful we're heading in the right direction, but I do think we need some leverage right from the top, and that includes governments and then leaders of organisations.
Thank you so much, Martina. This has been a very insightful discussion and presentation. I wanted just to give you an opportunity now to say some final words before we wrap things up. They can be recommendations, they can be a poem that you like, or they can be what to do next, or anything you'd like to share.
Look, again, I think I probably put most of it in my slides, but I think if I had to, based on just doing this study and immersing myself in this work and caring about it, I, again, would a call to arms to workplace leaders to consider who might be good champions in their workplace to take this work forward. I saw only 2 examples of what I'd call best practice initiatives of what was working well in workplaces, and they were very, very different. But one of the bigger ones in one of the larger organisations was around that there were leaders in the organisations who were actually okay about going, look, I've struggled with mental health, or I've had anxiety, and it led to a whole program of work being championed and implemented. So my call is to the leaders to if you can, find people in your organisation at that leadership level who will step up and champion the work, and then for the rest of us, where we can, to continue to be visible. And yes, finally, Pedro, we do need to at some point disclose when we are suicidal and reach out. We need that safe person to do it too.